this platform that we're talking on, we're in the US. To me, when I look at things more globally, it's alarming.
Why do you think a top-down healthcare initiative often might fail underserved communities?
It's tradition. It's quite plain to me. The top-down approach hasn't been working.
What would you say the mission of SP Collaborative is?
SP Collaborative also works a lot on the financial pieces and how to make sure that our providers, our suppliers, our hospitals, everybody is being reimbursed fairly.
What needs to change for some of these innovations to kind of make it?
I think you need three-prong approach, right? You definitely need more young people to be as passionate as physicians.
Hello and welcome to Healthcare Journeys. My name is Kevin Rosenquist. I am your host and thank you for joining me today. You know, in today's healthcare system, equitable access and culturally responsive care are often goals rather than guarantees. My guest today is Sonal Patel, founder and principal of SP Collaborative, an organization dedicated to helping healthcare and public health organizations build strategies rooted in equity, collaboration, and community voice. Sonal, it's so great to have you here. Thanks so much for being with me.
Hey, Kevin. Thanks so much for having me. I was so happy that I was invited to be a part of the healthcare journey with you guys today.
Well,
so
I was so happy that you said yes. So thank you for being here. I'm excited. I'm excited to talk to you. You know, SP Collaborative, your company, you guys partner with healthcare organizations, nonprofits, government entities, and you work to build equitable health strategies grounded in community wisdom. Can you walk us through what that actually looks like in practice, especially how it might differ from traditional models?
So, that's a wonderful question. Healthcare, this industry is $1 billion industry, right? And, I am relatively new to the field, right? And, things were very, very different when my father was a physician in this country for just shy of 40 years. Healthcare was very, very different. And so today, things are rapid fire, quick, technology, innovation. Everybody wants to work together to make sure the people have healthcare, right? And we know that there are disparities. And so that's where I like to really jump in and help as much as I possibly can in a collaborative way to see how I can strategically advise, implement new ways of working inside of institutions. I also provide a lot of insight when it comes to the variety of providers or suppliers in terms of what their service lines are, like specifically. So in terms of like, how do they set up a new service? Or, in conjunction with that, how do they make sure that they're documenting properly what those services actually are? So, it goes the full gamut from starting up a practice as well as working with larger institutions to see what their workflows and strategies need to become more effective and less siloed. It's just, one group of people working in one direction. No one is talking to each other. There's a lack of communication, often a lack of transparency to the people who are actually performing the work. So that's a lot of change that is being done, from a boots on the ground approach, because those people who are actually doing the everyday work want to see the higher level numbers and more transparent figures so they can help work cleaner to actually affect change instead of just, rinsing and repeating and doing the same thing without change. So I really love that, I can help as much as I can for whoever reaches out and asks, and I do have a wide network of people, but, it really does take the variety of providers, suppliers, pharmacies, whoever, to reach out and want to do something differently and take a chance on doing something differently to make sure the outcome is improved. So,
Mhm.
yeah.
And you emphasize equity driven strategy. Why do you think a top down healthcare initiative often might fail underserved communities, and how can leaders shift this dynamic?
Yeah, that's a great question, right? It's tradition. That's how I see it. It's quite plain to me. It's my opinion. The top down approach hasn't been working, right? And, I just don't understand why the C suites continue with that outdated model. I really applaud these smaller organizations, who are really trying to get in front and center. Their approach is on equity to those vulnerable populations, and they're not afraid to get in there and make sure that they're serving those people, right? And those organizations are growing, but I can't wait to see in the next, hopefully 10 to 15 years, many, many more people are included in healthcare rather than left behind. This platform that we're talking on, we're in the US, right? And so to me, when I look at things more globally, it's alarming, that yes, statistically worldwide, we are known to have the quote unquote best healthcare. And I'm putting my finger in quotes here, but when you know people who reside in other countries, the things they have to say about US healthcare is very, very different, right? So, yeah, you can read the magazine snippets and the newspaper articles and things online about how wonderful we are in the US and how much we do provide. But in terms of that equanimity, that is simply lacking. There are so many people, so many pockets of our population from all 50 states that just don't receive adequate health care, let alone trying to get coverage, right? When there's an open enrollment period, there's been so many failures when it comes to things like that, especially when it comes to recent things that my friends in my network have been sharing in terms of like fraudulent activity, that there are these brokers that go in and, try and let the consumer, quote unquote, shop for like 5 to 6 to 7 different products when they really only need one, right? And
Mhm.
that's all they signed up for. But then they have to swim on the back end trying to eliminate those unnecessary 6 to 7 products that they didn't even sign up for. So,
Mhm.
there's a lot of shenanigans also in the US. And again, I guess it's because healthcare is just so large here. It's so large, right? Um, when you take time to look at other countries that are obviously a lot smaller, and of course it looks amazing because they're smaller, right? And so they really do seem to have their handle on taking care of their people. Um, so there's a lot that we can take away if leaders in our communities can look around and look elsewhere to other nations and see what they are doing and how can we take away some of those things and implement it here. Would it work? I want to see a lot more of that conversation happening in our healthcare systems, in our communities, from the ground up, because I really do think a lot of people in these organizations, even whatever role they serve, they do much more outside the box thinking. And I do think in 2025 and beyond, there's much more room for those generous thought leaders to have their voice be heard. So, yeah.
I mean, you mentioned at the top, was you say billion dollar industry?
Yeah, I'm sure it's more than that, right? I just
Probably more, I would
yeah,
guess even. Yeah, but
exactly.
I mean, like, how do you change an industry with that much money involved? I mean, it's, there's plenty of different areas you could look at that in the world, but just speaking directly to this country, it's hard to get people to change when it's gonna might affect their bottom line. And
Yeah.
what needs, what changes would you ultimately really like to see? I'm sure there's a lot, maybe just a few. And how do you see us getting there?
Yeah. Another great broad question, right? I am a, rose colored glass human. I always have been, right? And so I always want there to be, equality
Right.
everywhere. And I hear you loud and clear that it's difficult to make those types of vast changes here when so many pockets um, are interested in where they are, right?
Mhm.
And why would they want to give that piece of the pie up, right? They have all of the pie, right?
Everything. Yeah.
Why would they want to give the pie to somebody else? So
Right.
I understand that, but I don't understand that, right?
Right.
Because we're not going to be around for forever. We're not going to be here. So what is our legacy going to be to the next generation, right? If we have children, um, what do we want to leave them? Are we leaving them this mess that we've inherited? Are we cleaning it up? Yes, there's technology innovations galore. Um, AI is huge, but in terms of actually, servicing healthcare, what are we leaving behind? Right. So I know I didn't even answer your question, but it's a difficult one, right?
Mhm.
Because yes, we want change, but how do we do it? I think we have to keep staying in the room. We have to keep pushing our way in, and we have to keep having those uncomfortable conversations and asking why and presenting a possible alternative again and again and again. And so, that's what folks in my network, we always talk like that. We always um, push the buttons, go outside the boundaries, always ask why. Why have we been doing it this way for so long? Why can't we try this approach? And I know it's not just me and my network of 700 people that I can talk to. There's many, many more people in healthcare that are like this, right?
Mhm.
And so it's just a matter of continuing to push, continuing to get in the door again and again and again, and taking every single opportunity that comes our way. If we really want to make an impact, and we don't just want to collect our paycheck and go home and be happy, that's also fine, right? But that's who I'm talking to, right? The people in the room who want to make a difference, who really want to impact some sort of valuable change, not just change for the sake of changing it,
Right.
something that is of value. So, yeah.
What would you say the mission of SP Collaborative is?
SP Collaborative literally is a brand new company. This is going to be rolling into its third year in January. New venture, right? So I have taken all of my years in healthcare, in working with providers, with physicians, with hospitals, with pharmacies, with DME companies, with attorneys. So I've worked with all of these various folks and learned so much, grew so much. So SB Collaborative is the same thing, but it's mine, right? So I am the one who is trying to help providers, hospitals, pharmacies, everybody, wherever they need a help in terms of strategy, in terms of how they bill for things, because that's a big thing in our industry as well in America, the way our reimbursement comes in. Nothing like what it is around the world. We have a very unique, very complicated, very obtuse reimbursement methodology.
Certainly.
So SP Collaborative also works a lot on the financial pieces, and how to make sure that our providers, our suppliers, our hospitals, everybody is being reimbursed fairly, because that is important, right?
Mhm.
Um, but because it's so complicated, right? And their wheelhouse, they're all amazing at their craft, right? Saving lives, dispensing the right dosages of medication. All of those things are in their wheelhouse, right? I don't know anything about that. I don't
Mhm.
ever profess to know anything about that. But when it comes to the medical coding of that, the financial pieces of that, all of that is in my purview, right? And so that's where I can help make sure that things are being performed in a very compliant fashion. And we haven't even talked about that yet, but in the US, healthcare has over the past 20 to 30 years become much more aggressive in terms of compliance. Yes, of course, it's always been there front and center, but now in terms of the federal government, the commercial payers, they've really been buckling down in terms of they want everything to be buttoned up. Otherwise, there's that chance for post payment auditing situation, and they could claw back their reimbursements that they received. And then that's very difficult to appeal and to get that cash back, right? So, all of those types of things I also help on as well. And I try and teach providers that it's better to be proactive and do things compliantly the first time if you work with a partner like SP Collaborative, who can quickly get you off the ground compliantly,
Yeah.
instead of them just taking a chance like, oh well, I this is the code, let me just use this code for this service, even though it's not matching, because it's a brand new service, right? Technology is amazing and it's something brand new, and there isn't quite the perfect code for it, right? And they're just guessing. And so I like to help come in and make sure that they're not guessing and just sending out something that's incorrect, because eventually someone is going to look on the payer side. So
Eventually. Yeah.
eventually, they always do. They
Yeah.
always,
When the
yeah,
money's involved, eventually they'll catch up.
they do. They do. Yeah.
So how do you what steps do you take to help companies, you know, become more equitable, become more, you said that you believe very strongly in equality. I'm with you on that. Very much equality kind of a guy. Um, Obviously there's lots of frustrations regarding equality these days
Yeah.
and for everybody. And what do you see in some of these organizations, and how can you help them become, more equitable and serve those underserved communities?
Well, the number one thing is, you know, not everybody can go in and serve those underserved communities, right? If they're the big surgical centers and things like that, right?
Sure.
But in terms of, trying to make sure that we have a lot more of our internal med people, infectious disease pockets, right? All of that needs to grow. I think the pandemic showed us all nationwide, loud and clear, how much more work needs to be done in terms of what happened to the people
Yeah.
when this little virus called COVID-19 came in, right? Like, so many people unfortunately expired, right? Because we didn't exactly know what to do, what the protection levels needed to be, et cetera, right? So it was definitely a wake up call and a learning that I think all of our providers and entities have used moving forward. So, I think it's a matter of obviously choice. It is still a free country, and our doctors and our hospitals have the right to go into whatever areas, big cities, the rural sections of each and every state. It's definitely choice driven too. But I really do hope that we'll see much more growth outwards from the big cities. So, everybody is taken care of properly, and not forgotten. And that also has a lot to do with our structure of obtaining healthcare, right? Like, how do we do that? Do all of the underserved know how to do that,
Hmm.
right?
Yeah,
I
like the
don't know if
messaging
you
isn't
know
quite
about,
right. Is that kind of what you're saying?
yeah,
Yeah.
like it's Obamacare is a beautiful thing, but it's complicated to get on
Mhm.
that, healthcare.gov. It's pretty complicated. They try to walk you through it, but some of those steps are complicated, and what they need from you to make sure that you qualify for a certain tier. So there's many different webinars that I've attended based on where I live. The CMS that's here in this region, they knew right away that they were like, "Can you attend? Because we want your input. Like, give us a survey. How can we improve?" So I attended this, 2 hour long thing, provided them my written feedback, on where their pain points are, right, and how we can tweak it, how we can improve it. So, there's many different ways to help once the larger organizations know they need some help, like they want honest, constructive feedback. I think that's also a golden opportunity for the bigger organizations to win.
Hmm.
It's as simple as, you know, sending out surveys, and people will be honest, and provide them with the critical feedback that they need to make those corrective steps, to, take those reviews, those surveys, those opinions to heart, and slowly find a way to make those changes happen. So, can definitely be done, but it's just a mindset shift. And the bigger organizations, the C suites, all of those types of people, who are brilliant because of their approach, right? They zoom from like the 25,000 foot approach.
Right.
They look down. They have that large sweeping view, but once they listen to the people on the ground, the people who are really in it, that's a winning combination, to look at
Mhm.
it from both angles, to come up with a profound, unique, solution for the future. Yeah.
But when it comes to the small, you were just talking about the big players, and it'd be great for them to get there. But for smaller community rooted ideas, they often don't get scaled. They can't, either
Yeah.
they don't want to, don't know how, or simply cannot scale. What needs to change, whether it's funding models, data storytelling, or just simply a mindset for some of these innovations to kind of make it further out?
Yeah. I think you need kind of that three-prong approach, right? You definitely need the funding. You have to have the funding, right? Like, somebody has to back you. How do we do that? How do we get those players in the room, right? That's very important. Nothing will succeed without the funding.
Hmm.
So someone has to be a champion to make that happen. That has to start. There has to be that second prong of the mindset shift. Like, you have to want the organization to grow, to flourish. You have to not continue having that limited mindset, right? That this is all we're going to be. This is all that we can serve because this is all we have, right?
Hmm.
If you think with more abundance, eventually things will change. I definitely believe in that, but it's not going to be something that happens overnight, right? I also don't think that successful stories, I mean, unless you're watching a movie, it's not going to happen overnight.
Hmm.
That
Will it
overnight,
happen in 2 hours?
no, it won't happen in two, like, yeah, it's not going to happen. It takes a lot of legwork.
Yeah.
to do something successfully, no matter what it is. Like, yes, we're talking about healthcare, this huge beast, but just when it comes to just everyday people, it takes work to find your success. It's
Mhm.
not just going to be thrown from the sky and you're an overnight hit. Like, that's just not true. It might be in the movies or in some Broadway play, but it's not real.
And has it become, you said that someone's got to do the legwork. Is it finding, is it a struggle to find people willing to do that legwork? Because I mean, also presumably if you're working for a small community driven entity, you're probably, probably not making huge money, right? So like to have the drive to go out, or if you're seeing patients or working on stuff like that, I mean, do you have the time? Do you have the bandwidth? Do you have the funds to hire somebody to do it? I mean, all these questions, these are all very difficult things for these smaller entities, right?
Absolutely. No, and you brought up great points, right? People are already overworked in healthcare,
Yeah.
stressed out, burned out of their minds, right? They're
Especially after
exhausted.
COVID, like you mentioned before. Yeah.
They're exhausted, right?
Yeah.
How much detriment we saw to our healthcare providers. Like, they were very sad. They were very burned out. Yeah, it's horrible to reflect on, right? Like, how many providers we lost
Yeah.
during the pandemic because of their sense of overwhelm,
Yeah.
right? It was
My
just shocking.
sister's a nurse and she
Yeah,
was very close. I mean, she's always loved what she did, but man, she was very close to jumping ship
that's
after
what I'm
COVID.
saying. Yeah, it's like we all know those people, and it's heartbreaking, right?
It is.
Because we lived it and we supported all of those people, right? But how many of our providers just couldn't take it? Even
Mhm.
though they had support systems, they were just done. They were like, we're leaving, So there was this mass exodus, right? And now the statistics show that there are very limited people applying to become physicians, according to the AMA here in downtown Chicago. And I'm like, well, we need doctors still. Like, we're all growing older. We need healthcare. We need providers. But there's so much that the pandemic did to the profession, right? There's so much that happened negatively, that we're still kind of paying for it. That application numbers are decreased, et cetera. So there's a lot of work that needs to be done to sort of put a new shiny spin on healthcare. That it's
Mhm.
wonderful. I know we're not talking that positively about it, but we need to, because we do need more young people to be as passionate as physicians from yesterday,
Right.
because they were, you know, the doctors that people still remember like years later, like, oh, doctor, you saved me, you helped me, you turned my life around, you listened to me, you took care of me for my entire life,
Mhm.
blah blah. Like, we need that level of dedication, again. And of course there are still the physicians that are working, practicing today, that are those people.
Of
I'm
course.
talking about the new generation, right?
Right.
We want the new folks to be just as passionate and just as inspired, to join the healthcare workforce. So, but
Are you worried that there aren't going to be enough?
well, the numbers are very, very low.
Yeah.
So it's going to take some time, for things to swing back around. But just in terms of the modeling of independent private practices have diminished also over these recent years. They've been gobbled up by the larger hospital systems,
Mhm.
which is fine. I mean, they're still practicing, but
Yeah.
they've been gobbled up and they're inside the
Under a different umbrella now. Yeah. Mhm.
bigger umbrella. So the opportunities for independence have just kind of shifted. And again, you make that choice. Can you stick it out? Can you do this independently? Or Is it going to serve you better to go ahead and go to the ASC or to the hospitals or wherever? So all healthcare has completely shifted. Things have completely changed, and change is the only thing that is constant in healthcare. We're not done just because it is 2025. Like it's still going to continue to change and shift and evolve, and our providers, practitioners, entities, organizations, everybody is savvy to continue pivoting and changing with the times, right? They've been doing it again and again and again. As far as change continues to come, they manage to maneuver, so it's pretty amazing.
It is. Yeah. And yeah, for sure.
Yeah.
What is there one change in healthcare culture that you hope that your work can help facilitate, something future generations might take for granted because it's just how it's done now?
Wow. Yeah. So if there's one thing, is there just one? It's never just one, right? But no, I really think, healthcare has just always been considered kind of, scientific and rational, and you just have to do it this way because it's science, and, we have all the evidence, and you just point to that, and that is it. But I really do think that healthcare at large would really improve, get better, even more innovations, etc., if they took a more, collaborative slant at everything, and making sure that all of their players from their various departments are talking to each other, listening to each other, to help provide for an improved organization instead of continuing to work in these silos, where it's just this department does their thing, that other department does their thing. They don't talk to each other. They don't know each other. All they do is communicate to the higher ups, and that's it. So that's how things continue to be disparate. This is the work I see every single day, is things are disjointed, and therefore it's harder to, help organizations make things flow better. When you're on the outside, you can easily say, well, if the other team just heard about this a few months ago from you, the solution could have been made, right? But they didn't know. And so months and months and months went by. It's things like that sadly have been going on for decades, right? And I really, really want that to be a fundamental change, that finally all of the departments in a various organization can talk to each other, can get together for the weekly meetings, the monthly meetings, instead of never seeing each other,
Right. Yeah.
never talking to each other. And now that, again, back to the pandemic, it brought us Zoom, it brought us Teams, it brought us all these platforms that were like never there. They were never used. Of course they were there,
Yeah.
but
Just
they were never
underused.
used, But it really shifted all of us to work differently. And so that's my biggest, takeaway, is I really want, the entire organization to be treated thoughtfully. Like, that's why you hired them. You hired them for something. So they should be applauded, and they should be seen, and they should be heard by everybody, not just by the person that hired you. You know what I mean?
Yeah, definitely.
So I really do think that something like that should be embraced in, the greater, umbrella word, catch-all phrase of healthcare. Um, you know, I would really like to see that happen.
Yeah.
Um, because I know folks in every single department, all sorts of departments, and they're all amazing. But if they don't talk to each other, right, it causes this continued confusion, this continued chaos, um, continued messes that need cleaning up. Um,
Yeah, and that's the way. That's what with any company, right? It doesn't have to be healthcare. I mean, that's any company
yep,
or industry. If you're not communicating,
yep,
how do you function
be
as
fun.
one entity, as one unit? You know?
Exactly right. It's across the board.
Yeah.
And I don't know why it's structured that way. I think you had asked some question or you had made some statement earlier about that is, why is it that way in organizations? I don't know.
Hmm.
I think it's just the tradition. That's what they inherited probably, and that's what they're taking away
Right.
as well. They're just pushing it forward instead of changing it. Um,
Yeah.
but
I
yeah.
think that's a good goal. Encourage collaboration, get people to collaborate, and see what happens. What it can't be worse.
Right. How can it hurt?
Yeah,
Right.
right.
Exactly.
Yeah.
How can it hurt?
So I didn't do anything bad. I mean, I guess unless people start screaming and swearing at each other, but hopefully that's not going to happen. I mean,
I hope not. Goodness. Yeah. Hopefully we can be diplomatic with one
civil human
another.
beings.
Right.
We'll try. We can hope.
Exactly. Yeah.
All right. Well, thanks for joining us today on Healthcare Journeys. Sonal Patel, the company is SP Collaborative. Sonal, thanks so much for your time. I really enjoyed chatting with you.
Thank you so much, Kevin. This was great. I appreciate it.